Bismillahirrahmanirrahim. Quote of the day: all it needs for a dream to come true is someone to believe in it. I am Dr. Alishba Rasool, and today I will be presenting Occupational Safety and Health Administration under the kind supervision of Professor Dr. Saira Afzal. Learning outlines: Introduction to Occupational Health, Ergonomics, Occupational Hazards and Diseases, OSHA, Elements of Safety and Health Programs, Measures for Health Protection of Workers, Recent Updates, and MCQs. Our learning objective would be, at the end of the presentation, participants should be able to describe the concept of ergonomics in occupational environment, occupational hazards and related occupational diseases, occupational safety and health administration, measures for health protection of workers, measures for prevention of occupational diseases. What is occupational health? Promotion and maintenance of physical, mental, and social well-being of workers. Prevention amongst workers. Departures from health, protection from risks, placing and maintenance. WHO Global Plan of Action on Workers' Health. To establish a baseline for measuring progress, information was collected in 2008 and 9 from the member states using a survey with questions measuring country status relative to the Global Plan of Action objectives, devising workers' health policy, protecting and promoting health at the workplace, improving performance of and access to occupational health services, providing evidence for action, incorporating workers' health into other policies. Now, what is ergonomics? Fitting the job to the worker, designing machines, tools, equipment, processes, layout, methods of works, and environments. Occupational environment consists of man and physical, chemical, and biological agents, man and machine, man-to-man relationship. Different types of occupational hazards: physical, chemical, biological, mechanical, psychological, and social. Occupational diseases due to physical agents like heat, cold, light, pressure, noise, radiation, mechanical factors, electricity. Due to chemical agents, gases, dusts, organic, inorganic, metals, chemical solvents. Due to biological agents, leptospirosis, brucellosis, anthrax, tetanus, etc. Occupational cancers of skin, lung, and bladder. Occupational dermatitis, dermatitis eczema. Psychological hypertension and peptic ulcer. Pneumoconiosis. Pneumoconiosis are a group of lung diseases caused by the lungs reaction inhaling certain dust. Dust particles of 0.5 to 3 micron inorganic and organic dust particles. The main cause of pneumoconiosis is workplace exposure. Environmental exposure have rarely been related to these diseases. The primary pneumoconiosis are asbestosis caused by inhaling asbestos fibers, silicosis caused by inhaling the silica dust, coal worker pneumoconiosis. Silicosis. It is caused by inhaling free silica, silicon dioxide, found in people working in mining, pottery, ceramics, sandblasting industry, etc. Symptoms include irritant cough, dyspnea on exertion, chest pain. Ground glass appearance on chest X-ray can be seen. Prevention include dust control measures like substitution, enclosure, isolation, hydroblasting, good housekeeping, and regular examination. Inorganic dust, anthracosis, coal worker pneumoconiosis, black lung disease, accumulation of the coal dust in the lungs and the tissues reaction to its presence associated with the coal mining industry. Takes 1 or 2 decades to cause the symptoms. Asbestosis, silicates of magnesium, calcium, sodium, serpentine, and amphipole. Asbestos cement fireproof textiles roof lining. Respiratory insufficiency, CA bronchus, and mesothelioma. Its prevention includes safer type substitution, rigorous dust control measures, periodic examination, and continuing the research. Organic dust, bagasosis. Bagasosis is the name given to an occupational disease of the lung caused by inhalation of bagasse or sugarcane dust. The symptoms consist of breathlessness, cough, hemoptysis, and slight fever. Initially, there is acute diffuse bronchiolitis. Sciogram may show mottling in lungs or shadow. There is impairment of pulmonary function. If treated early, there is resolution of the acute inflammatory condition of the lung, and if left untreated, there is diffuse fibrosis, emphysema, and bronchiectasis. Prevention include dust control, personal protection, medical control, and baggage control moisture greater than 20% and 2% propionic acid. Organic dust, bicyanosis, and farmer's lungs. Bicyanosis is caused by the inhalation of cotton fiber dust, textile, and fiber industries. The chief symptoms are chest tightness, shortness of breath, cough, and wheezing, typically occurring when patients return to work after a weekend or vacation. Smoking significantly exacerbates bicyanosis. Farmer's lung, type of hypersensitivity, pneumonitis, most abundantly found in breeders and farmers who were exposed to organic dust. Symptoms such as dry cough, shortness of breath, fevers, myalgias, and joint pains can be observed. Fibrotic lung and chronic illness. Prevention, powered dust respirator helmet, avoidance of work, leaving the farm. Occupational hazards of agricultural workers, zoonotic diseases, accidents, toxic hazards, physical hazards, and respiratory diseases. Health problems due to industrialization, environmental sanitation problem, communicable diseases, food sanitation, mental health, accidents, social problems, morbidity, and mortality. Fatal occupational injuries by major event 2015. Each year, thousands of workers die as a result of exposure to hazards in the workplace. Safety and health programs can help reduce these fatalities through a proactive approach to finding and fixing hazards before they cause injury, illness, or death. More fatal work injuries related from transportation incidents than from any other event in 2015. Roadway incidents alone accounted for about 1 out of every 4 fatal work injuries. As you can see, the transportation incidents are the highest, followed by the falls, slips, and trips, then contact with the objects and equipment, then violence and other injuries by persons or animals, then it's the exposure to harmful substances and environment, and in the end, there is fires and explosions. Occupational Safety and Health Administration, OSHA. Occupational Safety and Health Administration, OSHA, is an agency of the United States Department of Labor created under the Occupational Safety and Health Act of 1970 by Congress and signed into law by President Richard Nixon on December 29, 1970. OSHA was created to ensure safe and healthful working conditions for working men and women by setting and enforcing standards and by providing training, outreach, education, and assistance. Prevent, control workplace hazards, benefits of effective controls, protect workers from the hazards, help avoid injuries, illnesses, and incidents, minimize, eliminate safety and health risks, help employers provide safe and healthful working conditions. Elements of safety and health programs. Number 1 is the management leadership. Communicate your commitment to safety and health programs, define program goals and expectations, allocate the resources, and expect performance. Management leadership creates a culture of safety, facilitates trust, and reinforces the core elements. Worker participation results in better design, implementation, and evaluation. It encourages the workers to report safety and health concerns, encourage participation in the program, involve workers in all the aspects of the program, give workers access to the safety and health information, remove barriers to participation. Hazard identification identifies and documents all known and suspected hazards. collect existing information about workplace hazards, inspects the workplace, conduct incident investigations, identify hazards associated with emergency and non-routine situation, characterize the nature of identified hazards, determine the controls to be implemented, and prioritize the hazards for control. Hazard prevention and control prevents injuries using hierarchy of controls, engineering, work practices, administrative, and PPE. Identify the control options, select the controls, develop and update a hazard control plan, select controls for emergency and non-routine operations, implement selected controls in the workplace, follow up to confirm that controls are effective. Education and training ensures all workers understand safe work practices, are familiar with hazards, and know how to participate. Provide program awareness training, train workers on specific roles and responsibilities in the safety and health program, train workers on hazard identification and controls. Program evaluation assesses the program effectiveness and modifications needed. Verify the program is implemented and is operating. Correct program deficiencies and identify opportunities to improve. Benefits of safety and health programs: improvements in product process and service quality, better morale, improved recruiting and retention, more favorable image and reputation. Hierarchy of control, we will go from the least effective to the most effective. So from the least effective, we have the personal protective equipment. It protects the worker. Administrative controls change the way people work. Engineering controls isolate people from the hazard. Substitution replace the hazard. And elimination physically remove the hazard. Measures for health protection of workers. One is the nutrition, two, communicable disease control. Third is the environmental sanitation, water supply, food, toilet, general plant cleanliness, sufficient space, lighting, ventilation, protection against hazards, housing. Mental health, measures for women and children, health education, and family planning. These are the different measures: medical measures, engineering measures, and legislation. First, we will discuss the medical measures. Pre-placement examination, periodic examination, medical and healthcare services, notification, supervision of the working environment, maintenance and analysis of the records, health education and counseling. Engineering measures, designs of building, good housekeeping, general ventilation, mechanism substitution, dust enclosure, isolation, local exhaust ventilation, protective devices, environmental monitoring, statistical monitoring, and research. Now, what is legislation? Scope, Health, Welfare, Factories Act 1948, Employment, Hours of Work, Occupational Diseases, Hours of Work, and Employment in the Hazardous Production. SS Act 1948, Medical Sickness, Maternity, Disablement, Dependent Benefit, Extra Benefits. Extended sickness, limbs, protection against dismal, funeral expenses, rehabilitation expenses, and retirement. Now it's time for the recent updates. Occupational health and safety management in small-sized enterprises with particular emphasis on hazards identification. The article presents the element of occupational health and safety management in enterprises with particular emphasis on the identification of occupational hazards. The factor that may be a source of occupational hazards may have been classified and divided. The aim of the study was to assess the impact of occupational hazards on the work safety in opinion of the employees of micro and small enterprises. The research was carried out using the propriety questionnaire. The results were verified by means of a direct interview with the elements of observation. The research was compared with the trends prevailing in the enterprises of the European Union countries according to the results of the research conducted by the European OSHA. Polish respondents considered physical and psychophysical practice to be the main occupational hazards. The results turned out to be very similar to those presented by the European OSHA in its publicly available reports. the basic principle of occupational health and safety management, that is identification of occupational hazards, is reliability and correctness. Identification of occupational hazards gives the opportunity to take correct and effective corrective and preventive actions, reducing the occupational risk, for example, through the effective use of the personal protective equipment or a more detailed treatment of both introductory and instructional training. The article also highlights the migration of individual occupational hazards, which depends on many factors, both prevention, professional and non-professional. The Occupational Safety and Health Administration at 50, protecting workers in a changing economy. The passage of the Occupational Safety and Health Act of 1970 brought unprecedented changes in the US workplaces, and the activities of the Occupational Safety and Health Administration have contributed to a significant reduction in the work-related deaths, injuries, and illnesses. Despite this, millions of workers are injured annually and thousands killed. To reduce the toll, OSHA needs greater resources, a new standard-setting process, increased civil and criminal penalties, full coverage for all the workers, and stronger whistleblower protection. Workers should not be injured or made sick by their jobs. To eliminate the work injuries and illnesses, we must remake and modernize the OSHA and restructure the relationship of the employers and workers with the agency and each other. This includes changing the expectation of what employers must do to protect workers and implementing a requirement that firms have a duty of care to protect all people who may be harmed by their activities. Only by making major changes can we ensure that every worker leaves work as healthy as they were when their work shift began. Now it's time for the MCQ session, and I would like everyone to please pay attention and give their full participation. Which of the following health indicator is not included in the definition of occupational health? A, physical health, B, mental health, C, social well-being of the workers, D, protection from the risk, or is it E, economic status?
E.
Yes, it's E, economic status. Factory workers in different types of factories are exposed to different hazards. Handling of dangerous metals, solvents in an occupation can be classified as A, physical hazards, B, chemical hazards, C, biological hazards, D, mechanical hazards, or is it E, psychological and social hazards?
B. D.
It's B, chemical hazards. Industrialization plays a very important role in the economy of any country. Most effective way to control occupational health hazards is physically remove the hazard, replace the hazards, isolate people from the hazard, use the personal protective equipments, E, environmental surveillance. Does anyone like to answer it? It's C, isolate people from hazard. Occupational Safety and Health Administration is an agency of the United States Department of Labor. The main objective of OSHA about occupational health is A, promotion of well-being, protection of workers, C, placing of workers at appropriate place, providing treatment to workers, ensure safe and healthful working conditions. It's B, protection of workers. Mr. Ali has been working in a ceramic industry for the last 12 years. Develops fatigue, shortness of breath, loss of appetite, and chest pain. His chest X-ray shows ground glass appearance in both lungs. What is your probable diagnosis? A, farmer's lung, B, anthracosis, C, bagosis, D, chronic silicosis, or is it E, lung cancer? It's D, chronic silicosis. People working in textile industry are prone to develop a crippling lung disease due to inhalation of cotton fiber. The development of byssinosis can be prevented by all of the following except A, dust control, B, personal protection, C, medical control, D. Baggage control moisture greater than 20% or 2% propionic acid. Or is it E. Promoting dry cutting and prohibiting wet cutting? It's E. Promoting dry cutting and prohibiting wet cutting. A middle-aged man working in a shipyard industry for the last 14 years developed cough, hemoptysis, shortness of breath, hoarseness of voice, and weight loss. He went to the hospital for his checkup where he was diagnosed with a case of mesothelioma. What is the main cause of the mesothelioma? A. Pneumoconiosis, B. Silicosis, C. Anthracosis, D. Asbestosis, or is it E. Farmer's lung?
B.
No, it's D. A 40-year-old man working in grain market for the last 20 years presented with a history of recurrent infection for the last 1 year. His chest X-ray show pulmonary fibrosis, the likely diagnosis. A. Tuberculosis, B. Silicotuberculosis, C. Bagasosis, D. Farmer's lung, or is it E. CA lung?
C.
It's D. Farmer's lung. Employers must correct all identified hazards. However, which of the following hazards should the employer work first to correct? A. Guard missing on a piece of equipment used every 6 months. B. Broken rung on ladder used daily by the entire crew. C. Loose handrail on a dozer used by a single equipment operator. Wet floor by an eye wash station in a path not traveled by the personnel. E. Retraining of the new workers. It's B. Broken rung on a ladder used daily by the entire crew. Global plan of action whose mandate is to advance social and economic justice through setting international labor standards. The main objective of the Global Plan of Action about occupational health is A. Promotion of well-being, B. Protection of workers, C. Placing of workers at appropriate place, D. Providing treatment to workers, or is it E. No protection of workers?
C.
It's B. Protection of the workers. This is the key of the MCQs. Thank you, everyone. This is our YouTube channel. Kindly like, share, and subscribe. Thank you.
Thank you very much, Dr. Alishba. It is an excellent presentation. And the most important part is that you have covered very important aspects like WHO, OSHA, and other important occupational safety rules, as well as how they have been implemented. So, very well done. And the MCQs part is also very thought provoking. So, I must say that everyone should revise these MCQs again so that they can have a more clear picture, or they have the in-depth knowledge of the topic. So very well done, and Allah Hafiz.
Allah Hafiz, madam.
Allah Hafiz.
Hafiz, ma'am.